Well, that's just a short extract of a video which you can view on the Bhekisisa website about being hospitalized with COVID-19, which can often be a frightening experience, especially for healthcare workers. It's been an enormous and unusual challenge as well. Well, Bhekisisa Centre for Healthcare Journalism spoke to patients and healthcare workers in the red zone at the Nasrec temporary facility. Editor Mia Malan joins me now with more details. Mia, talk to me about your team's experience out at that field hospital. What did they find?
So we sent in a videographer and a photographer, and they visited the red zone, as you mentioned, which is the part where COVID patients are treated, and many are on oxygen in the red zone. Now, because things are going badly at so many government-run facilities, our team expected chaos and a lot of anxiety among the patients and the health workers. But to our big surprise, that really wasn't the case at Nasrec. As we have explained in our video, it can be a really terrifying experience to be a COVID patient because you really perceived as a hazard because you're so infectious. But patients we spoke to at Nasrec said they received emotional support, and it's clean and the food is good. And the health workers, they also have regular debriefing sessions with each other to cope with their stress. And unlike in many other state facilities, all of the health workers that we spoke to had regular access to personal protective equipment.
Mia, that's absolutely fantastic news. I think it's great that we do have, good positive stories in terms of the country's fight and response to COVID-19. Let's talk about the health workers and how they feel as they carry out their duties. Are they feeling safe?
So I'm going to talk about health workers in general in South Africa, where it's clear that many don't feel safe. And we know that from a survey that was released by the Health Sciences Research Council last week, that surveyed health workers, and 3/4 of them who were surveyed felt that they were at risk of infection because of their profession and their work environments. And the group of health workers who saw themselves as most at risk of infection was nurses. And that is really what is happening in reality, because if we look at how coronavirus infections among health workers in South Africa have occurred, more than half of the almost 30,000 workers that have been infected are in fact nurses. And the question, of course, is, are they able to protect themselves properly? Now, in this survey, many of the nurses said that they have not been trained in how to use some forms of protective equipment, for instance, special masks, the N95 masks that often have to be worn. And we've also seen that Nahawu, that represents a lot of the nurses, have consistently complained about shortages of protective gear for health workers, and they've even threatened strikes if the situation doesn't improve in provinces such as the Eastern Cape, for instance.
This week, we're also looking at the easing of regulations, and I think depending on who you speak to, there is generally an expectation that the COVID numbers may go up again, although not necessarily be as bad as they were before. Are there enough protocols in place, let's say in your areas like your pubs and your taverns, to ensure there's social distancing, to ensure that there is a minimal risk of infection?
So to answer that, we need to look at what other countries are doing. And many European countries with lower risks of infection than South Africa's have taken tougher stances on opening bars than we have. So, for instance, in parts of the UK, patrons aren't allowed to have drinks inside of pubs. If they don't also have sit-down meals, they would have to go and have a drink outside if they're only having a drink. Or music are, for instance, only allowed to be played at really low volumes to avoid people from shouting, which increases the risk of coronavirus transmission. But South Africa has opened up bars without any such regulations. The only rules really are that venues can't host more than 50 people at a time, and that alcohol can only be served until 10 at night, and that nightclubs can't open. Now, of course, people need to try to social distance, but they would be drinking, so it would be harder. And the South African Medical Research Council says it's made several suggestions to the government before the level 2 regulations were published. For instance, they suggested that there should be a limit on how much alcohol an outlet is allowed to buy, or that liquor shops shouldn't be allowed to run promotions for alcohol to make it available at very cheap prices during level 2. But these suggestions were not taken on board, and some experts now are concerned and argue that the lack of such regulations could result in South Africa seeing an even bigger surge in alcohol-related trauma admissions and also non-natural deaths than when alcohol sales resumed at the beginning of level 3.
All right.